Breast cancer. The breast is made up of glands called lobules that can make milk and thin tubes called ducts that carry the milk from the lobules to the nipple. Breast tissue also contains fat and connective tissue, lymph nodes, and blood vessels. The most common type of breast cancer is ductal carcinoma, which begins in the cells of the ducts. Breast cancer can also begin in the cells of the lobules and in other tissue in the breast. Ductal carcinoma in situ is a condition in which abnormal cells are found in the lining of the ducts, but they haven't spread outside the duct. Breast cancer that has spread from where it began, in the ducts or lobules, to surrounding tissue is called invasive breast cancer. In inflammatory breast cancer, the breast looks red and swollen and feels warm because the cancer cells block the lymph vessels in the skin. In the US, breast cancer is the second most common cancer in women after skin cancer. It can occur in both men and women, but it is rare in men. Each year, there are about 100 times more new cases of breast cancer in women than in men. Cancer is a growing problem. More and more cases are surfacing daily. Here is a look at the estimated number of survivors by the year 2022. Here is a graph showing the survival rate based on how advanced the cancer is. As you can see, at stage 4, which is the most advanced, the survival rate is only about 30%, whereas detected early, stage 1, the survival rate is much higher at about 95%. The symptoms of breast cancer and what to look for. Causes of breast cancer. Breast cancer occurs when malignant tumors develop inside of the breast. Cells can travel through the body by breaking away from the original tumor. This causes cells to enter the lymph vessels or the blood vessels. Traveling cells can enter into other parts of the body, causing damage to the body's organs and other tissue. This process is called metastasis. Symptoms. It is important to note the symptoms and warning signs compiled are general and can differ from person to person. Some of these symptoms are changes in breast color, redness, or changes in the breast skin altogether. Changes in the size of the breast, such as an increase in size. Peeling and dryness around the nipple, flaky itchiness. Most commonly known symptom is a feeling, a mass or lump on the breast. Discharge from the nipple, some discharge is bloody. Swelling lymph nodes, which could include under the armpits and around the collarbone. Here are some images showing the symptoms of breast cancer, which include pain, swelling, discharge, or swollen lymph nodes. Breast cancer risk factors. Family genetics. In your personal history, if there is breast or ovarian cancer in your family, that will increase the risk. Alcohol. Drinking more than one alcoholic beverage a day. Birth control. Taking birth control for an extended period of time. Menopause. If a woman's menopause begins after age 55. Diet and exercise. Poor diet as well as lack of physical activity. And being overweight. We must note that other risk factors include age, race, type of menstrual cycle, and the consumption of certain hormones. Treatments and therapy. There are three types of doctors who are able to treat breast cancer. A breast surgeon is a doctor who uses surgery to treat breast cancer. A radiation oncologist is a doctor who uses radiation to treat breast cancer. A medical oncologist is a doctor who uses chemotherapy and other medicines to treat breast cancer. Chemotherapy, however, is the most common method for cancer treatment. All three methods are successful in treating cancer. In some cases, multiple methods might be used to treat breast cancer. Chemotherapy. Chemotherapy may be used to help shrink a tumor prior to the surgery or radiation. It may be used with other treatments if the cancer cells ever return. Adjuvant chemotherapy is when a doctor uses chemo after surgery or radiation to kill any remaining cells. It uses three methods to help its purpose. Cure, which means the cancer gets destroyed and never returns. Control, which means the goal is to control the disease as much as possible if it cannot be destroyed. Palliation, which means doctors use this method to help ease the pain and symptoms if the cancer cannot be cured or controlled. Lung cancer. The lungs are a pair of cone-shaped breathing organs inside the chest. The lungs bring oxygen into the body when breathing in and send carbon dioxide out of the body when breathing out. The two main types of lung cancer are non-small cell lung cancer and small cell lung cancer. The types are based on the way the cells look under a microscope. Non-small cell lung cancer is much more common than small cell lung cancer. Most cases of lung cancer are caused by smoking. Lung cancer is the leading cause of death from cancer in the U.S. For most patients with lung cancer, current treatments do not cure the cancer. Symptoms of lung cancer. Most lung cancer symptoms don't show up until they have spread or grown very large. Some early and later symptoms are as follows. Early symptoms. Cough that does not go away, shortness of breath or wheezing, constant chest pain, coughing out blood or rust-colored spit, frequent lung infections like pneumonia or bronchitis, arm or shoulder pain, raspy, hoarse, or high-pitched voice. Later symptoms include drooping eyelids, facial paralysis, pain or tenderness in your bones or joints, difficulty in swallowing, weakness, shoulder pain, swelling of the face or arms, and bone fractures. Here is a graph showing the exponential increase in cancer research funding between 2011 and 2016. As you can see, lung cancer research funding has increased 255%. Lung cancer. What to look for. Lung cancer risk factors. Cigarette smoke. About 80 to 90% of lung cancer cases are a result of smoking. Secondhand smoke can increase your risk by 20%. Radon exposure. Radon occurs naturally in soil, water, and rock. It can be found in homes, schools, and buildings, and is the second leading cause of lung cancer. Asbestos. The tiny fibers found in asbestos can be breathed in and become lodged in the lung tissue. It was a common ingredient in many building materials and plastics, but it has since been banned. Hazardous material exposure. Hazardous chemicals like uranium, mustard gas, vinyl chloride, and diesel exhaust can increase your risk of developing lung cancer. Genetic factors. Genetics plays a role in the chances of developing lung cancer. People with a family history have a higher chance of developing cancer themselves. Age. Almost 90% of lung cancer cases are found in people 55 or older. These images show some of the symptoms as well as the stages of lung cancer. Some of the symptoms include a cough that won't go away, a bloody cough, or chest pain. Lung cancer treatments and drugs. The patient and his doctor choose a cancer treatment plan based on a number of factors, such as your overall health, the type and stage of your cancer, and your preferences. Options typically include one or more treatments, including surgery, chemotherapy, radiation therapy, or targeted drug therapy. In some cases, the patient may choose not to undergo treatment. For instance, they may feel that the side effects of treatment will outweigh the potential benefits. When that's the case, the doctor may suggest comfort care to treat only the symptoms the cancer is causing, such as pain or shortness of breath. Surgery. During surgery, the patient's surgeon works to remove the lung cancer and a margin of healthy tissue. Procedures to remove lung cancer include wedge resection, to remove a small section of lung that contains the tumor along with a margin of healthy tissue. Segmental resection, to remove a larger portion of lung, but not an entire lobe. Lobectomy, to remove the entire lobe of one lung. Pneumonectomy, to remove an entire lung. What is prevention? Cancer prevention is action taken to lower the chances of getting cancer. By preventing cancer, the number of new cases of cancer in a group or population is lowered. Hopefully this will lower the number of deaths caused by cancer. To prevent new cancers from starting, scientists look at risk factors and protective factors. Anything that increases your chance of developing cancer is called a cancer risk factor. Anything that decreases your chances of developing cancer is called a cancer protective factor. Some risk factors for cancer can be avoided, but many cannot. For example, both smoking and inheriting certain genes are risk factors for some types of cancer, but only smoking can be avoided. Regular exercise and a healthy diet may be protective factors for some types of cancer. Avoiding risk factors and increasing protective factors may lower your risk, but it does not mean that you will not get cancer. Different ways to prevent cancer are being studied, including changing lifestyles or eating habits, avoiding things known to cause cancer, taking medicine to treat a precancerous condition or to keep cancer from starting, risk-reducing surgery. Diet. Eating your way to good health. Maintaining a healthy weight can also reduce your risk of developing cancer. Excess weight causes the body to produce and circulate more estrogen and insulin, hormones that can stimulate cancer. This process is often triggered by excess fat cells in the body, so maintaining a healthy weight throughout your lifetime is just as important as achieving it. Eating nutrient-rich foods in moderation is key. A healthy diet is essential to cancer prevention, especially a regimen focused on making nutritious choices, favoring organic foods, eating in moderation, and preparing foods properly. It's all about balance, moderation, and variety. By eating the right foods, consuming a wide spectrum of nutrients, and not consuming more than your body requires, you can help reduce your risk of cancer and other diseases. Physical effects of cancer. Muscle wasting, chewing and swallowing difficulty, problems with cognition, constipation, sleep deprivation, mobility, mouth sores, no appetite, decreased platelets, weakness and fatigue, hair loss, and low blood count. Psychological effects of cancer. Depression. Depression affects at least 15 to 25% of cancer patients. With breast and lung cancer can come feelings of guilt, sadness, anxiety, loss of appetite, and thoughts of suicide. The suicide rate for cancer patients is 2 to 10 times higher than the others with depression. Chemo and hormonal types of treatment are large contributing factors. There are several different methods to combat the depression, such as exercise, asking family and friends for help, setting realistic goals, participating in activities, or talking to a therapist or psychologist. Antidepressants can also help patients cope. Risk factors. These factors can increase the chances of depression. Alcohol abuse, history of depression in one's family, limits on what you can do as a result of your symptoms, and no emotional support, and more. Social effects of cancer. Body image. A person coping with cancer can begin to have issues with their body as it goes through changes. This leads to patients alienating and distancing themselves sexually and emotionally from partners. Finances. Cancer treatments can be and are costly even if a person is insured. There are a great deal of out-of-pocket expenses that can result in debt. A troubling issue for patients struggling financially or for those who may have little to no income. Oftentimes, social and psychological effects intertwine, as they can go hand in hand. For those patients who suffer emotional issues after being diagnosed, they will also suffer from social issues as well. Much of the feelings they are having prompt them to withdraw from social events or encounters with others.